So I am happy and pleased to invite Purnima Menon here on the stage for the report launch of the agri-food system in South Asia, Pathways to Sustainable Healthy Diets. This report is put together from data, with data from South Asia, and this report is jointly produced by the CGR's Program for Scaling for Impact, CGR Program for Better Diets and Nutrition, IFPRI, and many other regional co-hosts. So over to you, Purnima. And I also request in the meanwhile all the poster presenters for poster pitch 4 to kindly come and sit in the front, because we will immediately go to the poster pitches after this session. Over to you, Purnima.
Thank you so much, Isha, for that. Let me just go ahead and invite all of the presenters in this session to please join me up here as well. Friends, I stand before you today not in my management role at IFPRI at all, but as a researcher who started together with Tim Krupnik at CIMMYT, an initiative to look at transforming agri-food systems in South Asia about 4 years ago. It was a CGIAR-funded initiative that was one of the first that was regionally rooted, and we had the opportunity to bring together researchers from several CGIAR centers, logos of whom you see on this flagship report, and I had the great privilege of learning about agri-food systems through the process of conducting this research. Tim is not here to join us at this launch, but I really want to extend my deepest gratitude to him. He's an agronomist, and I'm a nutritionist, and when we were asked to co-lead this effort, I can tell you that we had a lot to learn about in terms of how we each see the world. One of the key perspectives we took in the report itself, as soon as we realized that we were such an incredibly multidisciplinary team, each of us seeing the food system from our own angles, it truly was like blind men and the elephant. We said, well, how about if we look at this from plate to farm? Start with trying to understand what people eat and then kind of go back through the food system. And so you will definitely see that in the report. We realized as we were trying to do that, that we had to understand the food system in that way as well, because we were a team of nutritionists, agronomists, economists, climate experts, gender experts, market experts, and each of us was seeing some small slices. So our work is an offering. It's not, it's not something that I would call a definitive sort of report. It is an offering of a view of food systems that really takes, Jane, I really liked what you said, the idea of seeing a food system in a local context really helps you identify entry points. And so it's strongly rooted in primary data that looks at the entire food system in local settings using cost-efficient data collection and analysis methods. Our data has been in public since the day the data collection ended, almost. We didn't hold the data to ourselves, so it's also available for all of you to view. So that is the report, and we'll show it later. Do we have anyone else joining us on stage? Is Derek Heddy here? Derek? He's coming in 5 minutes, all right. So let's just get going with the slides, because it's a very short session and I don't want to take time, but I really do want to acknowledge the contributions of my other CGIAR colleagues who were part of the teams since day one at CIMMYT, IFPRI, IMI, and SIP, although SIP was not part of the report itself. Can we have the next slide? One should be able to do this. All right, wonderful. So we were thrown a challenge, as I mentioned, and we had to bring together a lot of people to begin to look at the food system. There are many aspects of the research that are already out there in public domain. The data itself is in public domain. There are several publications as well. And this report is really a sort of a bringing together. It includes contributors from multiple CGIAR research centers, from BRAC, GAIN, Nandi Foundation, the Institute for Economic Growth, Tribhuvan University in Nepal, JNU, Cornell University, and also some government departments and ministries. The report has several chapters, but they really cut across the food systems. If you take the food systems framework, you will see chapters that hit every part of it using the data that's available. We do have an overview chapter that sort of presents a view for the kinds of research and impact-oriented work we might want to do looking forward. But we start with the plate. What are people eating in South Asia? We characterize, certain components of what's actually maybe not always on the plate, but is part of people's eating patterns, which is the consumption of foods high in fat, salt, and sugar, really deep diving into India. We look very specifically at the issue of the lack of affordability of healthy diets, because that is such a central and often binding constraint, in particular in this region. And we really look at the implications of policy there. Again, building on themes that we've heard about at this conference as well, we have a chapter that looks at food environments and the behavioral drivers of food choice. We do take a sort of view of rural food environments and look into other parts of the markets themselves also. Now, of course, because this is about agri-food systems, and we went all the way from plate to farm, we have a couple of chapters in the report that really look at what's happening on the farm. So we look at what's happening with land. We look at what's happening in terms of how farmers are adapting to climatic shocks and what kinds of implications that has when you take a food systems perspective. Again, we recognize very deeply that, firstly, South Asia itself is deeply patriarchal, perhaps as much of the world is, but we took a very serious look at the gender side of the food system, trying to understand what gender roles look like across the entire food system. That work was led by Neha Kumar, who's there. We had a very strong youth focus, so there's a chapter on what's happening in youth. Our primary data was focused on families with young people. And then we also, of course, given the issues related to affordability, look very deeply at what's happening with social safety nets. But again, it's a deep dive look looking at India. There are other products from this work that look at the landscape of social safety nets in India. And then finally, because the agri-food system itself evolves and is centered around many systemic issues that include economic pathways, we look at structural features and policy priorities of that. So as I mentioned, it's an offering. We invite you to engage with the report and also think about the kind of research that you might do with it, do around these topics as you all look to the future also. So let me hand over to Derek, if he's here. No? Okay, so we're going to move not to the affordability. I'll just skip through that. And we will talk about diets. Do you want me to go back? Okay. Aklima, let me invite you to talk about diets. Aklima Parveen from IFPRI Bangladesh, please.
Good morning. It is a real pleasure to be presenting this chapter 1, What Are People Eating in South Asia? It has impressive list of authors, Samuel Scott, Rashmi Abula, and Molloy Krantrivida. I'm grateful for the opportunity to working with them on this report. The chapter synthesizes on evidence from National Dietary Guideline, the Global Dietary Project, and the TAPSA 23 district surveys across Bangladesh, Nepal, and India. Apologies for using this size a bit condensed. I would like to quickly share you some key facts from this slide. This slide gives a snapshot on how people, women and men, are consuming healthy and unhealthy food within 24 hours period using GDQS tools. So you can see that data remains poor and lack diversity. Fewer than 60% of adults consume fruits and dark green leafy vegetables in the past day, except Sri Lanka, age 78%. Only about 30% adult consume in Bangladesh dairy, the lowest among the 6 countries. Women in all countries were likely to consume less animal source food than men. Also, you can see unhealthy food consumption is widespread. Consumption of processed food, sweet beverages, sweet foods is now common across all countries, with a higher proportion of men than women. These are some key messages based on the last slides I would like to share you. So there is a limitation of data available on diet in South Asia. Diet varies significantly by age, gender, and wealth. Adolescents and men consistently consume more unhealthy food. Wealthier households do eat more healthy food, but importantly, they do not eat unhealthy food. So economic growth or purchasing power is not alone solve the problem. We need to address food environment issues. Also, improving diets requires coordinated and multi-sector action. We need stronger and clear regulation of processed and ultra-processed food. For multi-sector action, there are opportunities in the platform like schools and safety net program. The food industry needs to be incentivized to make healthy foods more affordable. Finally, so I would like to close my talk. Better data is required for better policy. Across South Asia, one of the biggest constraints actually the lack of routine and comparable data. Countries need more granular and high quality dietary data so that we can design targeted actions to get a better data pattern at the national and subnational level. Thank you.
Thank you, Aklima. Wonderful. Let me invite Derek, who's one of the co-editors of the report as well, to speak about affordability. Derek.
Thank you, and sorry for joining late. I was in an emergency meeting for the cyclones in Sri Lanka. So I'm going to talk about the chapter on the cost and affordability of a global healthy diet, but in 6 South Asian countries. And I think this data is really insightful. The cost and affordability of healthy diets is a new food security metric, but kind of a nutrition-sensitive food security metric that really captures the economic dimensions of food insecurity and nutrition very nicely. So if we look at South Asia, the first thing I want to say is we need to be careful with cost and affordability metrics. These are global metrics. Something that is sometimes misunderstood is that the adoption of this metric by the FAO and the World Bank has to be treated with a little bit of caution because the data really only pertain to 2021, and then there's extrapolations forward and backwards with food CPIs. But it's really important in South Asia that South Asian researchers and partners do their own cost and affordability calculations using national data sets and subnational data sets, because we're talking about, in many cases, huge countries, very diverse countries. So I'll talk about that a little bit more. But bearing those kind of caveats in mind, what does the global, comparable data across countries say? Well, first of all, the cost of a healthy diet varies between $2.91 in Pakistan up to $5.48 in Bhutan, right? So these, you can already see, this is just for the cost of a healthy diet, and this is already higher than many commonly used poverty lines, right? And then you can also see the next column there is median consumption. So Bhutan has relatively high consumption, but in many of these countries, consumption is only marginally higher than the cost of a healthy diet. And then finally, the last 2 columns here, we have the prevalence or the share of people unable to afford a healthy diet. And although this is quite low in Bhutan, it's quite high in the other countries. In Nepal, it's gone down because of very rapid income growth, household income growth. So 21% in Nepal, but all the way up to 57% in Pakistan. And then caveats around other countries, right? Sri Lanka, 2019, before the economic crisis. So it would have gone up in Sri Lanka quite considerably. And then if you look at the total numbers, well, like many statistics in South Asia, they're kind of staggeringly large, 917 million. Many of those in India and Pakistan, of course. But as I was saying, it's really important in South Asia to monitor this with national sources, national price data, national household consumption and expenditure data. But one thing we've been advocating, and there's a journal article in Food Policy and an IFPRI discussion paper on this, is monitoring healthy diet wages at high frequency. So Sri Lanka and India and Pakistan and Nepal and Bangladesh, very fortunate in that all those countries produce high-frequency wage data, monthly wage data, for different occupations and different genders. And you can use that along with monthly food price data to track the affordability of healthy diets or the healthy diet purchasing power of wages at very high frequency. So this is data, I think, that demonstrates the usefulness of this approach. So in March 2022, Sri Lanka had its worst ever economic crisis. Food prices doubled, so 100% food inflation in the space of just a few months, and also non-food inflation was very high as well, 60–70%. And you can see here, we've got 3 wage series. So the blue line is skilled non-farm labor for men, so this could be things like skilled construction, etc., masonry. And then unskilled non-farm labor for men, so this is like construction workers. And then tea plucking, so for women, so this is gender specific. And the tea estate sector is the poorest sector in Sri Lanka by far. And that's actually a minimum wage, believe it or not. So it's below $3 per day, so it's a terrible minimum wage. And you'll see that real wages, deflated by this healthy food price index, fell by 32% from September 2021 to September 2022. So this is the kind of thing we need to do because we know in South Asia, this is a region very vulnerable to all sorts of shocks, right? Macroeconomic shocks, environmental shocks, etc. So we've done a pretty good job in the last few years of measuring these metrics. I still think there's a lot more to be done on measuring these at high frequency, especially in South Asia. But we also need to start thinking about solutions. So in work we've been doing, I think it's very easy and neat to think about this in terms of the sort of 3 P problems, right? The poverty problem. How many people cannot afford a healthy diet, and who are they, right? And that's very important for thinking about pro-poor economic growth, inclusive economic growth, but also social protection, right? Because social protection transfers have traditionally been done on the idea of just reducing food insecurity, reducing sort of basic poverty, but those poverty lines don't capture healthy diets, right? So we need to think about social targeting to close the affordability gap. And then there's the price problem. We can look at which foods are expensive, and we can basically say in any country, it's fruits, vegetables, animal source foods, right? So agricultural ministries and other ministries need to think about how to reduce prices of those. And then lastly, the preference problem. Even if we give everybody enough money to afford a healthy diet, will they choose a healthy diet? No. So we need to do the behavioral change interventions as well. Okay, thank you. So.
Thank you so much, Derek. Some big problems showcased in a short period of time. Let me now invite one of our collaborators, Uma Koirala, to speak about the gender work in the report.
Thank you, Purnima. It is my immense pleasure to stand in this podium this morning and present my engagement in Chapter 8, Gender and Food System in South Asia. Thank you, IFPRI, and all for giving me this opportunity to for co-author of this chapter. Here we have tried to structure gender inequality drivers. We tried to explain these things and how it created gender shocks and vulnerabilities. And similarly, we talked about various gender vulnerability shocks, opportunities, and challenges in value chain, food environment, and consumers' behaviors. Within the structured gender systematic mechanism within countries and individual informal and informal sector to outcome of nutrition result in individual, household, and country level, such as dietary outcomes, gender equality and women's empowerment outcome, economic and livelihood outcomes, and environmental outcomes. we have envisioned some key messages that is quite important and essential to showcase in the chapter. First, as we all have realized that women are centered to agri-food system, but face structural barriers such as limited access to resources, weak tenure, and resource rights and social norms that undervalue and restrict their contribution. Similarly, women's time in reproductive and care work is really marginalized them, and their limited participation in productivity and market-oriented works are quite limited and undervalued. Gender norms and social hierarchies shape women's role and limit empowerment across the food system and agriculture to market to the distribution of tasks and food within household, affecting diet and nutrition outcomes of their family as well. Policy is the key drivers for market makers for systemic and meaningful changes. So policy must go beyond recognizing women's work to living access to resources, ensuring fair pay and safe condition, and tracking restrictive norms through gender transformative approach. Empowering women in food system requires intersectional data-driven action that addresses caste, class, mobility, and inter-household dynamics to ensure equitable food, livelihood, and health outcomes. And we have also identified some future research areas, including engaging men, particularly in sharing care works, reducing labor burden, and changing attitude of young through in school curricula. Thank you.
Thank you so much, Umaji. I think for us what was most visible in this report is when you take the gender side of things and realize that women are bearing the entire burden of food preparation and combine that with the findings on the increasing proliferation of ultra-processed and convenient foods, you see some interesting entry points there. Let me now hand over to Sam Scott, also a co-editor of the report, to take us through the rest and speak about adolescence. Thank you, Sam.
Thanks, Purnima. In case you haven't noticed, there are these little flyers on the table, and you can scan a code and go to the report. We don't have copies for everybody. And what we're doing right now, in case you're lost, is we're highlighting a few things throughout the report. So I'm going to finish those highlights on adolescence. And we know in the nutrition community that adolescence is a critical life stage in terms of intergenerational nutrition. But have you thought about what are adolescents actually doing in terms of getting food onto the table? So what are they doing in terms of production or procuring food or preparing food? This is something that we explored in our primary surveys in Bangladesh, India, and Nepal. This graph here shows a figure from Bangladesh, and we sat, I think, exactly 3 years ago now in Mystic Mountain Resort outside of Kathmandu, and we came up with a new tool to understand what people are doing in the household. And we came up with 40 different tasks across these 3 domains. This graph is showing something that we discovered in the survey, which is how male migration affects what adolescents are doing. So what you see here now is households that have adult males present. And the purple is the agricultural tasks, and on the left set of bars are female adolescents, and the right set of bars are adolescent males. And so you can see in 15% of households, adolescent females are primarily responsible for agricultural tasks, and in 15% of households, adolescent males are responsible. There's no gender difference there. But when you move to food-related tasks and domestic tasks taking care of children, cleaning the household. Female adolescents are doing a lot more than male adolescents. But when you remove the male adult from the household, when he migrates for work, what happens? Now, adolescent males really are stepping up to fill the gap there, and so you see a lot more participation from them. So a few key messages from this chapter are that adolescents play multiple roles in agri-food systems, all the way from producing food to acquiring it and consuming it, of course. There are increasingly surveys on adolescents looking at different aspects of their lives, and these have implications for agri-food systems. One of the things we measured was what they want to do or what they want to be doing in the future. And they don't want to be farming, for example. They would rather be, doing cool things like using AI and coding. Yeah, I talked about the participation in tasks. School meal programs aren't really covering adolescents. This is a big concern that a lot of school feeding programs end at primary school, and there's trade-offs there with limited budgets. Do we try to increase quality, or do we try to increase coverage and cover those older age groups? Finally, there's some exciting examples happening, and we highlight in this chapter one from Bangladesh, Gain's work on the Sun Youth Network, where they're training adolescents to be leaders and encouraging them to make better food choices. So that's all I wanted to say about adolescent chapter. Then we have a video from Tim Krupnick. So I can move to that. Do I just click next to play? Yeah. So Tim is the director of the Scaling for Impact Science program. I'm going to go back and restart.
Hi, everybody, friends and colleagues. My name is Tim Krupnick, and I was the Hi, everybody, friends and colleagues. My name is Tim Krupnick, and I was the leader, together with my colleague Dr. Purnima Menon, of the Transforming Agri-Food Systems in South Asia, or TAFSA initiative, that worked to develop the Transforming Agri-Food Systems in South Asia Agri-Food System Assessment and Report that we're very pleased to be releasing today. I'm also now in a role as being the director of the CGIAR Scaling for Impact program that has transitioned the regional integrated initiatives that worked under CGIAR's prior portfolio into a comprehensive and global science into scaling program that focuses on generating impact from the bottom up, from where demand drives our work across CGIAR. But I'm very, very pleased that we're releasing this report because it's a good example of a wonderful opportunity to take evidence that's generated from an interdisciplinary assessment of agri-food systems that worked looking from plate to farm and back to plate again across the value chain in different regions in India, Nepal, and Bangladesh, where we addressed and understood the cultural, economic, and agricultural importance of food for improving and having more healthy food systems as a whole. With the release of the report at the Delivering for Nutrition conference this year, I'm really pleased to see that we are putting forward evidence that can now be taken forward to support policy and informed decision-making that, it is my sincere hope, will influence change and positive impact with respect to food systems transformation at scale in each one of these countries, India, Nepal, and Bangladesh. The report and its release is essentially a high point for both the Transforming Agri-Food Systems in South Asia initiative, Although we closed in 2024, we are extremely pleased to release this important report. And also moving forward, it's really very important for the Scaling for Impact program that will continue fostering efforts such as this, not only in South Asia, but we hope to also support similar work at a global level. Thank you so much.
Okay, thank you, Tim. So a couple of quick thank yous. I'd really like to thank our communications and public affairs team for all their work to design a nice looking report. We hope it looks nice enough for you to read. And Amit Bisht, are you here right now in the room? He's outside, it's okay. He's part of the CPA team. JMed, who you've seen going around with the camera, as well as Pamela Edwards and Jason Chow from the DC office. And I'd also like to just thank Isha. She, 11 chapters going back and forth between reviewers and editors. It's a lot to coordinate, so she really held that together. Thank you, Isha. And everyone who contributed, all the reviewers, big thank you. This was like 2 years in the making, so we're happy to have it be launched. Thank you.
Thank you, Sam. Let me take a moment to actually thank the 3 co-editors of the report, Derek Heddy, Sam Scott, and Avinash Kishore, who can't be here. It's no small task to conceptualize a report, to bring it together, to work with editors, work with authors, reviewers, editors, a communications team, and the 3 co-editors and Isha together really carried the weight of that. So please put your hands together for the co-editors. Thank you. Before we close, I also want to just invite up on the stage all of the other colleagues who've had played a critical part in co-authoring reports. So let me welcome Neha, Sweta, Shumon, Alka. If you're in the room and you've contributed to a chapter in the report, please come on up so we can get a picture with all of you. And then I will hand this back to Isha in about 30 seconds. Thank you. Shumon here? Okay, good. All right, we'll just take a Isha, you can